Yeah, great. Thank you so much, Dr. McLemore, for joining us, and so appreciate your authenticity and just as we're sort of getting up and started. So welcome everyone to our seminar today. The seminar is co-sponsored by our School of Medicine's Health and Equity and Translational Social Sciences Research team and our Rangel Social Medicine Grand Rounds. So it's a pleasure to introduce and welcome Professor Monica R. McLemore to our UCLA seminar series. I do want to say that I don't think that my introduction and highlights of her career are going to come close to capturing her expertise, her accomplishments, her leadership, her advocacy, but I'm going to try to do a little bit of that. But just we're extremely excited to have you and really honored that you've agreed to share your time with us. So I'll start by sharing that Dr. McLemore received a bachelor's in nursing, from the College of New Jersey, a master's in public health from San Francisco State University, and a PhD in nursing with a focus in oncology genomics at the University of California, San Francisco. So she's currently a visiting professor at Meyers College of Nursing at NYU. And prior to her role as a visiting professor, she was a tenured professor and holding the endowed chair for health promotion and is a director of the Manning Price Spratland Center for Anti-Racism and Equity in Nursing at the University of Washington. Dr. McLemore is a noted scholar of anti-racist birth equity research and a national expert on reproductive health, rights, and justice. Her research spans the reproductive spectrum, including abortion, birth, cancer risk, contraception, family planning, and healthy sexuality and consent. Her work exemplifies the combination of nursing, public health, policy research, and really uses a community engaged approach and embedded methods of partnership to develop programs to test and deliver interventions. She has over 100 peer-reviewed articles, op-eds, commentaries. Her research has been cited in the Huffington Post, and she's also had several amicus briefs to the Supreme Court of the United States, and also a National Academies of Science, Engineering, Medicine report has also referenced her work. She's here today to share with us her expertise on how to understand health equity in this moment and when we determine to adapt, adjust, respond, resist, and observe. So please help me welcome Dr. McLemore. And again, thank you so much for joining us today.
I really appreciate the invitation because I think in this current moment, and today especially, it is really essential that those of us who work in public health, in clinical health services provision, policy, that we have spaces to be able to, number one, tell the truth, number two, to be able to vision and imagine, and number three, to be able to really, really work out where we fit, what we're comfortable with in this current moment. Because one of the things that drives me crazy is there's some people who absolutely, want to put their head down and do the work, fly under the radar. There's some people who want to actively resist and protest. There's some people who don't know what they want to do in this moment. And I think all that's okay. I actually think we need all of that. And so, as far as I'm concerned, I feel very grateful to have this space to be able to share some thoughts with you. For people who are curious, they are driving my slides, so I will say next slide when we're ready. Please write your questions in the chat. You can hit me up on social media as well. These will be shared with you. You can send me an email, whatever works for you. I am the editor-in-chief of Health Equity Journal, and I can just tell you that, anything I say, anything that's currently recorded, I will stand by every word. I'm not naive, and I'm not going to sugarcoat what I'm going to say to you. As a UCSF alum, I care very much about the University of California public education. I have 3 degrees from public institutions, and what's happening right now is unacceptable. And I will tell you, I have been on text and phone calls with reproductive justice people around the country, but specifically in Memphis, Tennessee, because the National Guard just got there. And I will tell you, these are some very scary times. They're very frustrating, but I will be very clear in 2 things. Number one, this is all temporary. And number two, we have to think about what do we want to rebuild, replace, in this current moment, right? Because not all of us can be panicked and not all of us can be trying to restore, right? So just recognize wherever you fall on this spectrum, I'm all good with it. But I need other people to unpack their feelings about this, because otherwise we will never collectively get where we need to be. So that's it. Next slide, please. I am currently a visiting professor at NYU. I'm sure a lot of people are very curious about this, so I like for people to understand pieces of my life. My parents have been married for 63 years. My father voluntarily entered hospice on Valentine's Day earlier this year. He is home with my mom. He is stable. He's happy as a clam. But I grew up on the East Coast, and despite the fact that I lived on the West Coast for 36 years, when my brother asked me to come back to help care for my parents, that's exactly what I did. So I am currently sitting on the ceded lands in Pennsylvania because I can't live in Jersey again. I live in Pennsylvania. I live in Philadelphia, and we're next for the National Guard. So there's that. Next slide, please. It's hard to acknowledge land without acknowledging the labor that's attached to it. When I was in Seattle, Washington, where I still have a home, we created this labor acknowledgement with Public Health Seattle, King County, so that we could really talk about the labor that is associated with the land. For those of you who don't understand, today starts that national reckoning with what happened, the atrocities at the Indian boarding schools. I hope you have heard some stories about that and are paying attention to our Native Indigenous colleagues, but it's really important for us to tell the truth in this current moment. And some of us can do that without direct cost or ramification, and some of us cannot. And so we have to be very mindful about that when we talk about health equity in this current moment. Next slide, please. I'm glad to see some people that are popping off in the chat. I'm glad to see the emojis. Please understand that I am okay with all of those things, because I think it's very important that we have opportunity to really work through our very complicated thoughts about living through this moment. Because I don't know about you, but 2025 has been my scientific term for this is a deep, hot mess. And, as somebody who's been behind many of the lawsuits, I was so grateful that the Washington State Nurses Association, along with the American Public Health Association and Academy Health, took the lead on suing the administration, because I don't know about y'all, but I have 5 PhD students who are trying to use BRIFIS and PRAMS and all sorts of other federal databases that were erased on January 25th. And if you missed it, a month ago, we got a settlement with HHS that is requiring them to restore those databases to what they look like on January 25th. I can tell you I'm leading a couple of teams to check and clean those data. They have not been restored in the ways that they should have. There's still some dead and broken links. There are data pools that have not been made available. So we're working on that. But it was really great to know that if you push back, you can at least have databases that the taxpayers already paid for. I had no problem fundamentally saying, if you don't want to continue those surveys moving forward, whether it's the Social Vulnerability Index or the Sexual Orientation and Gender Identity Database or the PRAMS, Pregnancy Risk Assessment Monitoring Surveillance Survey, or BRIFIS, or whatever it is, if you didn't want to collect those data moving forward, okay, you had an argument in the law and in the courts for that. But to disappear data that the taxpayers already collected is illegal. And quite frankly, in my opinion, unresponsible and unethical. Next slide, please. So yes, I participate in lawsuits. I think it's really, really important. So everybody asks me this all the time. Our current state of affairs is chaos, confusion, and panic. And everybody always says, Dr. McLemore, how is it you are so calm? Next slide, please. I'll tell you why. Well, number one, this isn't my first rodeo. I work in abortion, family planning, contraception, reproductive justice. We penned this. Remember the first time they tried to ban the 7 words at the Centers for Disease Control and Prevention in 2017? We have been trying to warn people for a very long time that those of us who work in reproductive health, rights, and justice, have had to live under this kind of regime since Roe was decided in 1973. And I would argue even before then. All of this no federal funding for abortion, family planning, contraception, that was hounds and hides. We've lived under that regime forever and still pushed our science forward. There are people around the world, global partners, who have historically lived with abortion bans, who've lived with illegal, reproductive health services. They have harm reduction methods and we could have a lot to learn from them. So as far as I'm concerned, why am I so calm? This isn't the first time I've had to deal with this kind of frustrating attacks on science, oppression, lies, misinformation, disinformation. They practiced all of this on us, and we have a ton of skills to help the rest of science. Now, as a molecularly trained bench scientist who studied tumor markers in ovarian cancer, and at some point, if you really want to geek out, I will explain why pregnancy and oncology are deeply related. In fact, I would argue from an evolutionary biology perspective, they are the same fundamental biological processes that are socially determined. Whether or not you have a tumor, whether or not you have a baby is a social definition, not a biological one. But okay, whatever. Next slide, please. When I think about the ways that science should have been acting before all of this and how we should be acting now, I use a very simple framework and I've added 2 additional R's to it. Retrofit, reform, and reimagine have been the hallmark of why we don't know what to do right now. And then I would also put restore and rebuild on this list. I'm working on that paper right now. Next slide. If you want to be able to have access to this paper, yes, I published this because I thought it was really important to share. I'm still pretty grumpy. It's behind a journal with a pretty significant firewall. So if you do want or need this, email me and I will be happy to send you a PDF because I get very irritated that people can't access it. Next slide, please. I'm also going to put my current email address in the chat. These next 4 slides, they come from Merriam-Webster Dictionary because I like to get everybody all on the same page of what we're talking about. You're in California, or I'm making an assumption that you're affiliated with an institution in California. I lived there for 36 years. You know what a retrofit is. You know what it means to keep a structure and put an awning around it, put scaffolding around it, and retrofit it so it becomes more resilient to, earthquake safety. Well, in my mind, retrofitting is what a lot of people are trying to do right now. They want to restore the NIH funds. They want to be able to get back to study section. They want to restore, retrofit. They want to be one of the lucky ones that might, get one of the, autism and, vaccine research grants. Because I want to know who the 100 people were that actually responded to that RFP. You know how powerful it would have been if nobody would have applied? But see, you can't have that conversation if you're in a retrofit mindset. You think what we had should exist, it should continue to exist, and you're going to fight like hell to do so. And I'm here to remind people that the Centers for Medicare and Medicaid Services were signed into law the year before I was born. They have not existed in perpetuity. The Department of Homeland Security was developed in response to 9/11. We have restructured federal agencies since their existence. So for us to act like somehow this is new is very strange to me. Next slide, please. When you think about reforming something, there are 4 definitions in Merriam-Webster that I think are very important. Reforming something means that you can actually change the structure. Retrofitting, you're not changing the structure of anything. So in my mind, being able to change the structure is really important. When I talk to clinical learners, I always tell them that the retrofit in healthcare is anybody who does research on healthcare financing. Anything, any intervention, whatever you do, it's all a retrofit because until you change insurance, then you're not really changing the structure of the problem. Okay, reformation. You really decided you wanted to do that? So my cat's going to be making an appearance and talk. Y'all can get over it because she does what she wants. In reformation, you can change the inherent structure of something. So it's not like you can just say, oh, we're going to tweak around the edges because we can't have a national health system or single payer or whatever. In reform, you can change the structure. And this is where I'm trying to get a lot of academics, especially those at the associate and full professor level, because we could convene an entire brain trust to think about what should replace the NIH. We could do that. We could get every academic medical center. We could get every center of excellence, bonus points for people who have sports teams, because then we could also probably work and push the Department of Education. Why? Because if we don't have the scholarships and the fundings for our students to play sports, then your Friday night lights are going to go off. And therefore, like, we need people thinking about reforming the existing things that we have to push for what we want and what we deserve, right? That's not outright resistance. Next slide, please. If you want to be on Team Reimagine, right? And those are the people, in my opinion, who are the resistors, right? They want to recreate something new. They want to resist all the things. We need to rebuild something brand new. Let's hit up philanthropy. Oh, by the way, we should dip into our endowment and fund our own work. Them people, right? We need them too. We need them thinking about what are the new domains of science. Those are the people who figured out and pushed when we were doing HIV work, the activists who really pushed to make sure that there was representation in clinical trials. Those are the people who really pushed NCI when we moved from, site-based understanding of tumorigenesis and cancer to really thinking about looking at molecular pathways regardless of where those tumors were showing up. Y'all remember the rules of tumor cells and the hallmarks of cancer? That was huge. And NCI adjusted their funding mechanisms to it. So we can do this. This can be a thing. But we all have to get out of our grief, panic, frustration, anger, and hurt. Next slide, please. When I think about rebuild, okay, rebuild has two definitions, right? There's a transitive verb definition, and then there's an intransitive verb definition. I like all of them, and we need all y'all thinking about this, because you can reconstruct, which is different than remodeling, which in my opinion is different than to build again or to rebuild. So wherever you fall in this continuum, if we were going to reconstruct, I would argue, because Representative Lauren Underwood said this, I was just at the Congressional Black Caucus Foundation annual legislative and policy meeting in DC. She said one of the reasons that they put most of the money for the momnibus into HRSA was because it was a workforce issue, but it turned out to be one of the most brilliant moves that they could have made. Why? Because they've been targeting the CDC and they've been targeting the NIH. They haven't been messing with PCORI or HRSA. Those programs are still moving forward. So we need to think about what could we reconstruct. Here's the one crazy idea, and I'll give out my crazy ideas for free so y'all can run with them and hopefully it activates you to think differently about what else we could be doing. Why don't we use the infrastructure of our scientific and professional organizations and scholarly journals, follow ACOG's lead, reject federal funding, and then have philanthropy run their fellowships through the professional organizations? That's what Robert Wood Johnson has done. That's what, I mean, so when we think about, so for all those early career scholars who are so worried about their case, who are so worried, they're coming out of postdoc, they don't know what to do. Well, okay, because I know my journal publisher is ready to sue. We're not changing our name from health equity. We're not asking people to ban words in their publication. Your employer might, but I'm not. I've asked people to be able to write 2 manuscripts. I know it's more work. Write the one you submit to your employer if you got to do that, and then write the one that I'm going to send out for peer review. Right? There are ways to outsmart this current situation if you can accept the fact that it's temporary. Right? I think we have about a year, maybe 24 months of some serious pain. I am hoping we can continue to avoid deep violence. This National Guard situation makes me very uncomfortable. And, I have lived my entire career, both clinically and as a researcher, with active and credible death threats. I won't wish that on anybody. So as we continue to think about rebuilding, maybe one of the other things we want to think about is where are employers and for-profit entities in this conversation? Because I do think we need their help. Next slide, please. So when I think about retrofitting, okay, next slide. I'm going to show you a lot of pictures. I'm going to tell you a lot of stories. When I first wrote this piece for Scientific American, I didn't want it to only document dead, Black, pregnant, capable people, which is why I really pushed them to change the title and the framing of a data visualization project that will live in perpetuity. So as you're publishing your work right now, be thinking about the orientation, the context of this moment. And if you have an opportunity to concretize where science should go in the future, I'm not asking you to overextend your research findings from your aims and all that, but be thinking about where can we subversively suggest where science should go and could go. Where can we be documenting past pathways or other practices around the world that have had to exist when assaults under science have occurred? Where can you carefully put into your manuscripts justice, joy, and hope for our early career investigators who are feeling pretty hopeless right now? Be thinking about that. Be mindful of how you frame your work for publication. Next slide, please. Go back one, please. So there's a reason that Democrats are trying to hold the line and are willing to shut down the government, and they keep saying healthcare, because y'all know that that's about the earned income tax credits for the poor. You know that that is about the enhanced premium tax credits. Y'all wait till you see open enrollment bid rates. I am the chair of the Washington Healthcare Exchange Board, and 21 states have their own exchanges where people can purchase their own insurance on the individual marketplace. Those bid rates have gone up 28 to 33%. That's for everybody with employer-sponsored health insurance. The reason the Democrats are fighting for this is because we know we not only do we get improved healthcare outcomes when we fight for postpartum Medicaid coverage and expansion, but we also know that those rural hospitals, those hospitals that are serving the underserved, many of them are going to go under without the Medicaid program, right? A lot of us, I mean, we're all at academic medical centers, so I'm making that assumption because I'm speaking to UCLA and I'm at NYU and I still have faculty appointment at UW, but just recognize that, like in Washington State, where my house is, half the hospitals in Washington State are staying afloat because of Medicaid and Medicare funding. 1 out of 6 of those hospital beds are religiously affiliated. And the religiously affiliated people, that's another group of people we need to talk to, because we want to see them up their charity care, right? In this current moment, because there's going to be more people in need. So this idea of how can we be thinking about who within our domain, our sphere of influence, can we be talking to that we need their help, at least for the next year, 24 months? Who else can we make asks of? Everybody who's thinking about the long-term impacts of the loss of NIH, 20 years, this 20 years, that, where are my 2-year people? Where are the people that actually want to help maintain and protect right now? Because we need some of our brilliant brains thinking about that as well. Does that make sense? We need our early career people not to feel like they've thrown their lives away, studying, researching, trying to understand the phenomena because of this craziness that's going on right now. Because I don't know about you all, but I'm not prepared to let science die on my watch. Like, that's not a thing. So as we continue to think through this current moment, figure out, are you a retrofitter? Are you a reformer? Are you a reimaginer? Are you a rebuilder? Right? Be thinking in that way. Next slide, please. So if we're going to reform, right? I believe in legislation and litigation. I believe in suing people because right now that is actually really helping to prop up our entire healthcare and scientific infrastructure. However, if we're going to reform, be thinking about it this way. Next slide, please. Okay. We don't just want to go back to what we historically have had, right? A lot of reproductive health rights and justice organizations have put together roadmaps. I'm not just putting this up for me because I authored this with 38 people around the world to be able to really think about how to re-envision, to reimagine. Like a lot of reproductive health rights and justice have written How do we look differently at scientific infrastructure? And one of the things that we've been really excited about, I did this with the Black Mamas Matter Online. PCORI is using this as part of their work to really think about how do you authentically engage the public? Because here's another way we need to think about. So we need to add, we have to talk to the public. We need to make asks of them, not just as patients, not just as taxpayers. We have to ask them as human beings on this planet, how can we remodel, rebuild, reframe, rethink health services provision and the benefits that many of them are about to lose? We need their help in getting the people who are our elected representatives, and we need their help to hit up the employers. We need their help. They are our greatest asset. It's just like those of us who are faculty. We always think about students, but I have said we need to engage the staff who are our greatest untapped resource in supporting our educational and research missions. So if we bring along the public, I think we can actually maybe get somewhere in terms of helping them to understand this current moment instead of a lot of the navel gazing that I see us doing and the pontification and the rolling around on the floor and the sadness that we have around what we perceive is lost. Next slide, please. So I fundamentally also think that when we got to stop, if you haven't figured anything out, abortion was never an either or conversation. Neither is size of federal government, neither is, funding of the biomedical research enterprise. Nothing is a binary. Nothing. And that's why people get so worried and confused about trans folks, even though they only represent like 1% of the population. It's because they disrupt this notion that A, there's a right answer, that B, things aren't more nuanced than they actually are, and that C, curiosity and questioning is a way more powerful tool and a scarier one than just accepting an existing paradigm. So for me, I always say this, and I've been saying this recently, and I'm totally serious when I say this. If you can use your emojis or show a hand or whatever, how many people got a call from HHS, from Doge, or anybody else when they decided to break healthcare? Because I can tell you, I am a nurse. I come from a long tradition of nurses and researchers, and I am pretty angry that nobody from HHS, nobody from CDC, nobody from Doge called me or anyone in my profession up if they were going to break healthcare and then expect to fix it. Because we have had decades of nurse-led interventions and nurse-led models to reform and reimagine healthcare and health services provision, and yet we were not consulted about how to do that. So I actually think from a professional and a disciplinary perspective, some of us can plug in more than others. I would argue that our global health colleagues and our public health colleagues might not be in a position to plug in, but I really feel like those of us who are clinically autonomous and prepared, our physician colleagues, nursing, dentistry, pharmacy, physical therapy, respiratory therapy, we actually can plug in and make collective demands about, okay, so now that, what are you going to algorithm your way through a study section, peer review? Like, what are we doing? Right? What's the class action lawsuit that the health professions should put together based on the psychological harm we've all had to endure? And I'm totally serious, right? I am upset and I want remuneration and retribution for what has occurred. And I will work with Democracy Forward, Democracy Docket, ACLU, If, When, How for Lowering Reproductive Justice, the Center for Reproductive Rights. I'll work with all of them because I'm already working with all of them to do it. I am not going to act like we sat on the harms that we had to deal with through COVID, the occupational and environmental exposures that we had. I think it's time for a class action lawsuit in civil disobedience in healthcare. Next slide, please. I fundamentally think if we're going to reimagine, and I know there's a lot of people, see, and thank you. We're going to write that paper, Gloria. Remuneration, retribution needs to be, and the institutional betrayal is huge. My good collaborator, Dr. Monica Casper, who is the Dean of Arts and Sciences at the Seattle University, she has a book that's coming out that she's co-edited, and it's about university and institutional betrayal. And if you don't understand that concept, I highly recommend you think about it because, you know, AAUP has been also writing a lot about this, but I think we need a collective impact approach. So those of us who have been members of the professoriate, regardless of what your, you know, domain of expertise is, we need a collective strategy to be able to do it. You can go ahead to the next slide because I think the roadmap that we need to use is going to come from the collaboration between the clinical sciences, public health, and the social sciences. I actually think if we bring together justice and critical frameworks, if we really ground our science in human rights and research justice, I actually think that opens up a whole new aperture for us to be thinking about what legislation we need, what litigation we need, and what demands we need to make on our employers and the employer groups who we care for. Now, this is going to sound very extreme to people on this webinar, but I actually said this in March after I penned my op-ed in health equity. Can you imagine? And I come from nurses, and I've been a SEIU nurse my entire career. So I am not on team we don't strike. I'm not on team we don't walk out, right? Can you imagine if every academic medical center approached the Department of Education and said, we will not be able to provide any care, both globally at our comprehensive cancer centers? If we all would have said that and then followed through, I actually think we'd be in a very different landscape. Would that hurt? Absolutely. But are people hurting right now? Absolutely. Right. So these qualitative decisions that people are making about future harm versus current harm is irritating. And I really need us to get out of that either or thinking and start to really lead in the ways in which we were trained. Next slide, please. As the holders of science and our future brain trust, these documents have existed for a very long time. I'm sorry they're so small, so I'll walk you through them. One is from my collaborator and colleague who is a sociologist that was at UCSF when I was there. She's really talked about power and positionality in participatory budgeting. You bring your community members in and research community, parents, whoever like that you're working with, and you co-create the budget, power and positionality with them to help garner trust. One of the reasons we haven't said that we want community engaged research because it's fun and oh my goodness, you get to have, you know, better science and more authentic results. All of that is true. But one unintended consequence of working with community, and I have a paper under review about this right now, is that I think it's actually a mechanism to rebuild trust in science and to combat misinformation and disinformation, because community members become our ambassadors. They have skin in the game. And it's not just because they're being paid as research participants. So it's like this citizen science approach that I guess at some point we either let go of or didn't think was rigorous. I don't know what it is, but we need to get back to that. The other documents you'll see on the right, and both of these are publicly available. One is on the Preterm Birth Initiative site at UCSF. The other is a published manuscript that is not behind a firewall. Is data use, community data use agreements, right? I mean, when I think about the data use agreements that came out of mapping the human genome, which was happening when I was training, that people agreed to freely use data, that we would leverage the power of different labs. We can do that again. We can be thinking about strategies to help restore public trust in science, because if we can do that, then the public will understand why it's so important to fund it, why we need federal funders for biomedical research, right? They would completely appreciate the relationship between K through 12 science, like Feynman tried to teach people, and curiosity of the world. So I think we need to get back to some of those tried and true techniques and methods. Next slide, please. I want us also, and this is where I've been spending a lot of time, the scientific peer review process. So when the Department of Justice sent letters to CHEST, Pediatrics, and New England Journal of Medicine, health equity, of course, they've been trying to shut down health equity since our existence. And if you don't know the origin story of Health Equity Journal, it was actually philanthropically started by a grant from Kellogg, because a lot of people were having a hard time publishing data and findings in legitimate journals about social determinants of health and about health disparities and health inequities. And so a group of scholars came together, and Kellogg went to Mary Liebert, who was the original publisher of Health Equity. Mary Liebert was acquired by Sage, which is a UK British company. And Mary Liebert agreed to match for a decade the monies that Kellogg put up to be able to field an open access, accessible anywhere in the world journal that would have a prioritization for social determinants of health, health equity, health inequities, and health disparities work. And I'm lucky to only be its second editor in chief. And one cool thing about being an open source journal where you can publish around the world, if you have an internet and or a mobile connection, that has a really great impact factor. We're pushing for 3. We got 2.9 last year. Is we waive our APC charges. We have a sliding scale for countries that can't necessarily afford it. But the really cool thing is our publishers are willing to sue on behalf of our science, because we will not allow for it to be retrofitted with lies and disinformation and misinformation. So one of the things that I've been spending a lot of time getting those of us who are involved in scientific publishing, we are the last line of defense for our science. And I am telling anyone and everyone, if you have something that you even think is worthy of publishing, submit it. I know it is slow. I know we are taking a long time. People don't want to review. I get all of that. But the International Committee of Medical Journal Editors has been very clear about our rights. They have been very clear about protecting our science. I'm really glad we have policies and procedures in place, not forcing people to retrofit their last publications or any publications. I can't tell you how many people have called me up in the last month who have gotten just in times to edit their submitted grants from the last cycle, because they know I keep a table, and I think I might have a slide on it, of banned words and what words to use to replace them. So for the people who are ethically fine in this moment to take out banned words from your grants, whether it's women or transgender or equity or whatever it is, I got a table for you. And for those of you who are not comfortable neutering your work in that way to be able to maintain your funding, we need to suspend judgment around the people who are willing to still do that, right? This is where the nuance and the complication and the messiness will be very, very helpful. And we still need institutional strategies that are collective to be able to leverage on multiple levels. Next slide, please. So people were stunned when they found out that, because I am a resistor. Oh, you can skip this one. Next slide, please. I'm a resistor, but I also am practical, right? I come from a long line of, Black people who have suffered oppression in this country for a really long time. So as far as I'm concerned, it's a both and. We can chew gum and walk at the same time. And I don't think anybody's legitimacy is reduced because, they have a really great grant with really great ideas and they want to continue to do the work and fund their programs, and they're willing to make changes and sacrifices to do that. I also have no real judgment around people who are not willing to do that. And that is a red line that you can't cross, right? Reproductive justice is always about a both and. Next slide, please. So that said, I know this is going to be news to some people, but you all do realize we can outsmart racism, right? And we can outsmart ignorance. You can talk about culture shift. They haven't said a word about that, right? If you don't want to talk about DE&I, yeah, you can talk about institutional transformation. You can talk about climate and culture. And I don't mean climate like climate change. You can talk about your institutional climate, right? Sarah Ahmed has a whole book about this called Complaint, right? You can talk about peoples and systems. You can talk about emancipatory science. I was struck that emancipatory wasn't on the list. You know, they didn't strike out humans either, or health and human services from the list. Next slide, please. So I don't think I had a chance to update this. I think it's still from March, but this was the banned list that PEN America keeps. So I put the source on there. You can go ahead and check it. And I highlighted certain words on here. I mean, breastfeed plus people, breastfeed plus person, abortion, LGBTQ, people-centered care, prostitute, which I thought was funny, you know, because I'm like, okay, whatever. And like, but they didn't put sex worker on here. Like, this is how random they are. Next slide. So when you're thinking about your work and what you're comfortable with and when you're not, team up. The retrofitters have to team up with the reimaginers, and then you have to also team up with the rebuilder. We need mixed teams. You can't just sit around and pontificate and pine for what we lost. That can't be a thing, right? Start thinking about infographics. Some of mine have actually shown up in policy briefs. I was really stunned to see that 2 community-based organizations that I work with put our infographic on their fact sheet for the congressional staffers because the picture was easier to remember than the bullet points. Okay? Work with your learners and students to do mock congressional briefings. Know what we want to say, right? Be thinking about if you had 20 minutes with the Democrat, or 20 seconds, excuse me, with the Democrat that right now that's going to shut down the government around healthcare, what would you say? Because I know exactly what I would say. I would say refund Medicare and make sure to earn income tax credits as well as the extended tax credits for people who purchase their insurance on the individual exchange don't see an increase in their rates. One sentence. But you have to have that prepared. That has to roll off of your tongue. You can't be trying to have a dissertation because they will walk away from you, right? I appeared in a documentary film called Everybody's Work that was about addressing racism in nursing. Yeah, they might come after Hollywood, but nobody has taken any films out of the festivals. Nobody banned the movie theaters. I'm looking forward to seeing Tron Ares next month. Come on. So we have to think about, scientists have got to think different. There was a reason that, you know, a lot of well-renowned scientists started writing trade paperback and books for the public, writing books for K through 12, right? Writing books for children. When we think about radio spots, right, we need to start thinking about talking directly to the public. I am working with people to do some Instagram lives, you know, YouTube specials, some TikToks. We need science communication, right? I love the theatrical readings that we do called SCOTUS Theater when I was at Advancing New Standards in Reproductive Health, where they would read the decisions and have like a reception, invite the public. We need to have a public, recreate the public marketplace for the communication of science. And it needs to be meeting people where they are, not where we want them to be. They're not reading peer-reviewed papers in the library. So we have to think about that translation. How, even if we're only going to do harm reduction and maintain right now, what point about your field do you want the public to be able to roll right off their lips? Because I know in my field, anybody and everybody can tell you that we need more doulas and more midwives, and they can't even tell you why. Or people in my field will tell you Black women are 3 to 4 times more likely to die from childbearing related complications than white women. People can roll that right off their tongue because we've done a lot of work to make sure that people understand those statistics. Next slide, please. I'm gonna wrap up and then we're gonna have some conversation because I see some stuff in the chat. Here's the other thing. For the full professors that's on the call, and if you like me, well, I'm not tenured yet. So I'm a visiting professor because all my materials are going through at NYU, but I am still a full tenured professor at UW. For those of us with the protections of tenure, as long as it still lasts, I'm talking to y'all right now. You have to have courage and curiosity. Next slide, and I'll tell you what that means. That means if you have capacity to write an op-ed, a commentary, a perspective, or whatever, now is the time. I wrote this op-ed. You will notice that it was accepted for publication on February 26th, and at Health Equity, we put our papers up the day after it's accepted in draft form. This was pretty early on that I made my stance very clear on behalf of my associate editors. And the reason I'm the only person that's named on this is because 3 of my associate editors are pre-tenure assistant professors who are very vulnerable. One is a trans woman who did the PhD first. Dr. Litt is very clear about her positionality, but she's also a resident in emergency medicine. And they were all okay with me signing my name, right? We stated very clearly that we are going to publish what is accurate and ethical. We will continue to be the authoritative information about health disparities and health equity among vulnerable populations. And whether or not authors choose to comply with whatever institutional restrictions on language, concepts, and measures, we will insist on accurate science and appropriate citational practices. So we were very clear what we would and would not do in this current moment, because I think it's really important that somebody of my stature, somebody of my tenure, be very, very clear for early career people so that they know they have a future to look forward to, that they didn't waste their time or their lives, that we in for a year or two that's going to be really hard. Absolutely. But their work is valuable, it is meaningful, and there will be a place for it, because people like me are going to fight like hell to make sure that's true. Next slide, please. So when I think about who you're working with and where you're at, this is on my contact information. That's my email address. That's me on socials. I'm going to ask them to take slides down, because by my count, we have about 10 minutes where I can dialogue with you all. I can answer questions. I can tell you what I know about whatever. But health equity is not going away, not as a construct, not as a concept, and not as a journal. And even though funding might look different, and I have been speaking to all the big funders, whether it's Commonwealth or Robert Wood Johnson or Buffett or, Open Forum, although unfortunately, it looks like, the administration has decided they want to come after funders as well. But okay, Open Society Foundation and Soros and all that, they're ready to fight. I mean, Rich Besser from Robert Wood Johnson was like, we stand with them. So just recognize that chaos and panic, even if you just want to put your head down and do your work in this current moment, you're doing good work. I don't know who convinced people that everybody's going to be fighting right now. Everybody's got to be mad. Everybody's got to be sad. If you are still funded, because I am, right? I've never had federal funding. So actually, my whole research program has not been impacted by any of this madness. I'm busy as hell. I have 8 funded grants right now. So if you're still going to put your head down, hire as many people as you can, maintain your work as much as you can, protect as many people as you can, you are still doing good work. So I will take whatever questions y'all got. I see there's a couple things in the chat that I want to address. And some people have sent me some DMs as well. But okay. I have a webinar. So I'm going to be in residence at the Center for Reproductive Rights. So this is for the person who asked the question about working with lawyers in litigation. I have a webinar. I'm going to be in residence. I'm using some of my NYU startup money. I'm going to be creating a webinar series for if you want to involve, like, what's the 101 on litigation? And I don't mean expert testimony in the courtroom, that kind of, there's a lot of people don't understand. I do a lot of summaries of science for lawyers and judges to help them understand complex concepts, so that when we get to the amicus brief or the friend of court brief writing, they understand the background. How many people knew that's actually a job that scientists can do? And it's like, sometimes you get consultant fees and sometimes it's, pro bono work, but you can put it on your CV as a public summary of science. That is very important work that I do. I give talks. So I was at the Association of Women's Health, Obstetric, and Neonatal Nursing, and I asked the lawyers from If, When, How Lawyering for Reproductive Justice, and I asked the lawyers from the Center for Reproductive Rights to be on a panel with me. And we're standing room only at 7:30 in the morning, answering people's questions about self-managed abortion. And what was going on with Adriana Smith, the Black nurse who is kept alive to gestate her fetus at Emory, right? We took 177 questions from nurses at a professional conference. Oh, you want to ask a lawyer? about malpractice in this current environment, asking about your ethical responsibility, 177 questions. And we use Slido and we use written note cards in the room so that people could be anonymous if they wanted to be, because I don't believe in digital surveillance, right? So yeah, that's how there's so many ways that we could work with our lawyer colleagues right now. I'm going to do a whole webinar series on this because clearly the only way that scientists think that we can work with lawyers is to either sign on to an amicus brief or to be an expert witness, because that's traditionally, historically, what nurses and physicians have done in courtrooms, right? But there's a whole other role that people are carving out in medical legal. And I think we need to do some training around that. Okay. The other question about the National Institutes of Minority Health and Health Disparities. Here's what I know, okay? And it changes every day, so don't take this as gospel and say, Dr. McLemore said, no. I know of one person who actually got a just in time and got funded for their application they wrote in the last cycle. So clearly they still giving out money. So is NICHG. One of my collaborators, they just got a multi-PI. We got 1 day to scrub the grant of all of the words that we couldn't use. And everybody rallied in my school to be able to help them rework that grant. And they found out yesterday that they are receiving their R1 that's going to be funded. So as far as I know, NICHD and NIMHD are at least still giving out money as of yesterday. Let's see. Litigators. Okay. At some point, we're going to have to run for office. I know I am, right? So don't forget, 6 physicians signed a Declaration of Independence. Just saying. So at some point, we're going to have to really think about who amongst us, right? Lauren Underwood is a nurse. She's Hopkins trained. I love her. She represents Napier and, in Illinois. A Black woman who has been elected 3 times in a rural part of Illinois because she do the work. She brings money. Momnibus is like 12 bills. She has brought millions to Chicago and other rural areas just looking to transform the perinatal workforce. So at some point, we also have to think about legislation. Now that's it. Making 1-pagers is really important. I would say make it a half a page. The other thing you need to start doing is hitting up your students and doing some TikToks with the students and tagging your representatives. I have a TikTok account. I have never used it. I'm a lurker. I always snag my name on all new social media platforms, because if I don't, then disinformation and misinformation happens and people try to misrepresent me. And I spend all my time trying to kill the Nazis, bots, and trolls. I'm very irritated. So I snag my name, which is McLemore MR, everywhere, whether I use my account or not. But the cool thing about being able to have a TikTok account is I can tag in my students when they make good scientific content, because I assign it in my class. I let people do whatever they want for their final product. They can give me, I've gotten infographics, I've gotten poems, I've gotten podcasts, I've gotten TikToks, I've gotten IG lives, I've gotten YouTube shorts. And then I get their permission and I either publish them on a blog that I have, I'll publish it in Health Equity, or I will ask their permission to send it to their legislature. And that's what I do. So you got to be rethinking these assignments and working with students, because they are your biggest untapped resource. Okay. All right. My advice and inspiration for early career scholars. If you can put your head down and work with whoever your mentor is. I just told somebody this morning. I said, can you take a 3rd year on your postdoc? Because nobody's going to care, right? If they can fund you, postdoc salary is better than none. And you're competing with all the fired federal workers and the people who are now looking for employment that took the buyout and their benefits ran out in September. So if you can take another year, I highly recommend that you do that. If you have to pause your work and maybe go work for community-based organizations or go work clinically, do that. Make peace with it. You're still doing good work in the world. And if somebody tells you that you can't leave academia and come back, ignore them and never ask for their advice again. They're lying. Nobody know what's going on right now. We don't know what we're going to rebuild. We have a prime opportunity to reimagine this whole thing. So stay away from people who talk to you in absolutes, because nobody knows. Because trust me, if anybody knew, and I'm pretty plugged in, and I'm sitting here telling you, I don't know what this is going to look like, they don't know either. And the other inspiration that I have is, think about the most uncanny, crazy thing that you could be doing. I trained during HIV and AIDS in the 80s. I went to college in 1988, and I have my ACT UP pin, pink triangle. Like, no one knew. Those activists didn't recognize they would shift an entire field. So don't let go of opportunities because you might have some sanitized view of what an academic does or doesn't do in your head. Because we don't really know.
Mhm.
So just recognize that. All right, I'm gonna take the last question. I'm sorry, but there's like a ton in my DM, so I'm trying to get to all of them. Look, y'all email me because I'm gonna answer all of them. I'm committed to doing it. Okay. AI. I have IG lives on this. I am an early adopter to technology. I hate AI. My brain works, and so does everybody else. I need y'all to use it. AI is an environmental harm, just in terms of its data needs and its energy sources. There's a whole algorithmic justice league that's been led by Black women on the harms of AI. Quite frankly, I also think it's lazy. It's like leftovers, and I don't like leftovers.
Yeah, that's so true.
So I can't, I think we are going down a rabbit hole with AI because there's I'm gonna end with this. The messiness of the human condition is not going to be fixed by AI.
Right, right.
And I'm a
So
nerd.
well said. Yeah. Thank you so much, Dr. McLemore. I feel like I said, I would not have been able to introduce you and represent the wonderful person you are. And so thankful that you have finally, sort of landed with us here at UCLA. And I really, really do hope we can circle back and keep learning from your wisdom and
Yeah,
just
I'm happy to roll
yeah.
up. Thank you for having me. And
Thank you so
please,
much.
you feel free to share the recording and my slides. It's all good.
Will do. Thanks again.
Thank you.
Bye bye.
Bye.
Thank you. Bye.